Hello, my name is Kayla Caldwell. I'm a second year biology major on the pre-medical track from Detroit, Michigan. And today my topic is going to be reviewing the physician's assistant position in healthcare. We're going to start with a brief overview of what is a physician's assistant. A physician's assistant, better known as a PA, is a licensed medical professional who practices medicine as a part of a healthcare team, usually under the supervision of a physician or MD. PAs are trained to provide many of the same services that doctors do. Some of their tasks may include conducting physical exams, taking patient histories, developing a treatment plan, prescribing medications. In all states of the in all United States, they can prescribe medications, order diagnostic tests like x-rays and MRIs, assist in surgeries, and provide patient education, counseling, and many more. Okay, my next slide is why I chose this career. Honestly, I would be happy having any career in the healthcare profession. I love helping other people, making an impact on others' lives. PA is close to an MD, which was my main goal, and this is like the closest profession that you can get to that. Healthcare allows me to make a direct impact on people's lives for the better. I enjoy comforting patients during stressful times and vulnerable moments, just being that person that can be there for them, because I know how stressful times like that can be. And being a PA blends knowledge, compassion, and community service, which is things that I am very high principles on. And they have meaningful work, personal growth, and they have a good work-life balance. So the skills and talents that are needed to become a physician's assistant. So some of the basics are having strong knowledge of anatomy, physiology, and pharmacology like you would any other health profession, and the ability to perform physical exams and lab results like you would in any other health profession, because PAs are thoroughly responsible to do those roles. Another skill and talent that is needed is essential communication, critical thinking, and problem solving, because you have to solve problems really fast, and you have to make sure that you are being an aid to the people that are stressed out, don't know what's going on. You can never know what's not going on, because your patient always needs to know what's going on. Strong communication and teamwork. PAs work in teams. Everybody in the healthcare profession is a team. So if you don't know how to work in teams, this will not be a good job for you. And also conflict resolution skills, because a lot of conflict can occur, especially in healthcare. Organization is a big skill to have. Attention to detail, time management skills, as well as compassion and emotional resilience. My next slide is personality traits that physician's assistants have. Empathy is definitely needed for a job like this, taking care of other people, taking care of people's families, and things of the sort. So you need compassion, patience, and empathy. The ability, adaptability in fast-paced environments, because the hospital is very fast-paced. Ability to stay calm under pressure, and ability to talk to patients calmly even in stressful moments, because you cannot be stressed out if they are stressed out. Organization is key. Observational skills and strong multitasking, attention to detail is essential. Emotional strength to handle difficult medical situations, and be willing to do long, needy tasks, because that's a lot of what physician assistants do. So my next slide is education and training. How long do you need to be in school to be a physician's assistant? So similar to other healthcare professions, you need a bachelor's degree with the pre-medical prerequisites, which would be anatomy and physiology, pharmacology, intro to the health professions, classes like that. And then people usually do a master's program for 2 to 3 years, similar to a post-bac. And then supervise clinical rotations. And then you must pass the PANCE exam, which is like the MCAT, but that is the physician's assistant's it's the physician's assistant's test that's just like that. Yeah. So prior healthcare experience is recommended for applying to physician's assistant school. The master's PA program is basically getting accepted into a physician's assistant school. So this total time, it will take you 6 to 8 years to complete all of this. About 4 years in undergrad, 2 to 3 years in your physician's assistant school or master's program to become a physician's assistant. Some people take time off to gain experiences and that time to be able to even be accepted to a master's program or a physician's assistant school. And similar to all other specialties, you must pass the board exam to become a licensed practicing physician's assistant. Here are the work conditions. Places that you may work is like clinics, hospitals, of course. Some physician's assistants end up having a desk job. ERs, urgent cares, and private practices is always going to be a fast-paced setting, but it depends on your specialty. Many may work nights, weekends, and holidays, but they have a nice work-life balance. Your job duties will be exams, diagnosing illnesses, ordering tests, assisting procedures, education, and follow-ups. A typical day would involve balancing patient care and documentation. You usually work 8 to 12 hours assisting MDs with rounds and exams. You may also have to diagnose a few patients and even assist in surgery, but you can be home by 5. Here's a slide talking about what physicians also do, which is take medical histories, perform physical exams, diagnose and treat illnesses, order and interpret tests, prescribe medications, assist in surgery, and provide patient education and counseling. The future outlook for a physician's assistant job, strong job growth. There are a lot of physician assistants positions open due to physician shortages. The median salary is $120,000 per year. The entry level salary is $95,000 per year, but it varies by your specialty and your location. The opportunities for advancement are surgery, emergency medicine, pediatrics, dermatology, and leadership roles. And you have the ability to switch specialties and even open clinics in some states. Technology that physician assistants use on a daily basis is electronic health records, EHR, diagnostic imaging tools and lab software, telematic platforms for robotic assistant procedures, artificial intelligence for diagnostics technology, improves accuracy, speed, and patient outcomes. So the usual technology that you use in the hospital, the PAs use that times 10. In conclusion, In conclusion, I learned how rigorous and rewarding the physician assistant profession is. It blends compassion, science, and service. While I feel confident that this is a career where I can really grow. I want to inspire other young Black women to enter healthcare, and I look forward to serving my community through patient care. Here's my lyrics cited. And thank you. This is my conclusion.